Hello, welcome to Natural Health Today. I'm your host, Dr. Stephen Blomerth, and our Natural Health Today show is dealing mainly with what you are interested in, your complaints, your concerns, the problems that may affect you or your family. And what we do is we invite you several different ways to participate in the show. You can send in your questions via email to pbdchiropractic@gmail.com. You can telephone my office at 978-535-6155, or you can send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. But whichever way you choose to participate in the show, what we'll do is we'll slightly disguise your name so your friends and neighbors won't know exactly the problem that you're calling in about. And then we'll talk about natural health means that you can use to get better, no matter what the type of problem you have, because I'd say fully 80 to 90% of day-to-day run-of-the-mill problems that people take to their medical doctor and usually end up taking drugs or having surgery for don't require drugs and usually don't require surgery. They respond very well to what we call natural health care. When I think of natural health care, I think of four main avenues that we use with our patients. One is joint manipulation, because if a joint is stuck and not moving properly, it can have all kinds of reflex effects that may cause pain locally, but may also cause symptoms and what we call dysfunction in other areas of the body. So freeing up stuck joints is one avenue that we use to help people get better. Another is muscle work. And I'm not exactly talking about massage, I'm talking about trigger point work and myofascial release, because muscles have these coverings over them called fascia that can extend from your foot all the way down to the back of your head and neck. So these long chains of connections are a bit like the different tensegrity forces that hold up Buckminster Fuller's geodesic dome. You know how the geodesic dome all interconnects and holds itself up. Human beings and our limbs, our body, our bones, and our joints work in much the same way. So if you have a muscle that doesn't move and contract properly and glide just as it should, it can cause pain or dysfunction not only in the immediate area, but in areas a long ways away from it. The other way that we treat people is with exercise. And I'm not talking about the type of exercise you're going to get in a gym. I'm talking about exercises that use what we call the small stabilization muscles. You've probably heard of things like core training. Well, the type of exercises that I recommend for most people are taught by foundation training people. Foundation training people do a very good job of exercising the muscles that are weak, that need strengthening, and stretching the muscles that are overly tight. So foundation training is not exactly stretching, and it's definitely not the type of weight training that many people are used to. It's somewhere in between. The exercises can be easy, but they can also be quite difficult to do. So there's a wide range of abilities that you can have in order to start doing these exercises. You don't have to be an athlete to do them. And the fourth, and probably the most long-term way to help yourself, is through your nutrition. And I'm not just talking about taking a one-a-day vitamin or going by the government food pyramid groups. I'm talking about paying attention to what you eat. It doesn't always have to be organic. It could be organic, but probably the biggest thing is sticking to a low carbohydrate, high fat and high and moderate protein diet. For most people, that's the secret to losing weight, but also to calming down inflammation. So with those four avenues of helping people, we help most of the patients who walk through our door get appreciably better, and once again, without drugs, without surgery. So I'm going to put on my reading glasses now that you know the basic ways that we have to help people, and I'm going to read some of the questions that have come in since our last episode. Okay, Dan writes in from Danvers. He says, when the summer comes along, I really love fresh corn on the cob, but my wife says I can't have it because I'm on a low-carb diet for my diabetes. Yeah. I thought I could eat all the vegetables I want, just no sugar. Who's right, Doc? Okay, so just to restate the question, Dan, apparently he must have diabetes, and he really loves fresh corn in the summer. But his wife says he can't have it because he's supposed to be on a low-carb diet. And what Dan is saying is that he thought he could eat all the vegetables he wanted, just having no sugar. Well, unfortunately, Dan, as in most things, our wives tend to be right, and your wife is right, because corn, I don't really call it a vegetable. I call it, it's more of a grain. Corn may grow in a field, or you may find it at a vegetable stand, but its net effect, what it delivers to us, is not like broccoli and not like lettuce. It acts more like a grain. And the principal way it acts on us is to very rapidly raise our blood sugar level, just like sugar. And the measurement that we go by is what we call the glycemic index. In other words, how quickly does something raise your blood sugar level? If something raises your blood sugar level really quickly, that means it's going to act just like sugar, because a quick raising of your blood sugar level also causes a quick downfall of your blood sugar level. And the reason it falls down so quickly is we put out a lot of insulin. And that's how people get type 2 diabetes. Having a quick rise up, demanding a lot of insulin. Insulin gets put out and then crashes the blood sugar level back down. But it's bad for just about every system in your body. And eventually, your body loses the ability to put out insulin because you've called upon it too many times by eating things like corn, which makes it go up very quickly, and so does sugar. And so does certain fruits, like pineapple. Pineapple and corn, I would just totally exclude from my diet if I was a diabetic. So Dan, once again, your wife was right. Eat all the fresh vegetables you like in the summer, except not corn and not potatoes either. Okay, the next question. Stephanie writes in from Middleton. She says, I've been feeling a little lightheaded lately, but it was no big deal until I fell in the shower. I didn't hit my head, but I did tear down the shower curtain. My husband insisted that I tell my doctor, and of course he ran half a dozen tests, but they all came back negative, so all he could say was, you need to lose weight. But how can being overweight make you feel lightheaded when they tell me there's nothing showing on the tests? So Stephanie, that is a good question. Your husband certainly was right to say, yeah, you should have an examination after you fall in the shower, even if you didn't hit your head. I mean, it's a great thing that Stephanie wasn't injured, but the thing is, why did she get lightheaded? You know, in the shower and fall, not hurt herself, have a series of tests, and they all came back negative. So she didn't have a type of condition that they might have been looking for, like something wrong with your brain. They probably did a brain scan, particularly if you say, well, I fell in the shower. The first thing they're going to think is, you must have hurt your head. No, I didn't hit my head. Oh, you might have hit your head, so we're going to do a brain scan. They did a bunch of tests on Stephanie. We don't know what they are, but they all said negative. What they mean is negative for tumor, negative for trauma, negative for broken bones. But it doesn't really put a finger on why a person might feel lightheaded. All they could come up with was, you should lose some weight. Well, if you are overweight, it opens up the door to a few other possibilities. One is Stephanie on any blood pressure medications? Because blood pressure medications don't act the same way all the time. If Stephanie had a cold and you have blood pressure lowering drugs, that can actually lower your blood pressure too low. people say, well, what's wrong with your blood pressure being too low? If your blood pressure drops too low, you will feel dizzy, you will feel lightheaded. And if you're in the shower and you feel a little bit lightheaded, that could be one of the reasons why she might have fallen. How about the fact if you're overweight, you might have high blood sugar? I know it sounds like, oh, well, how can that be a problem? Well, high blood sugar, if it goes up high, it can also drop very low. And when you have low blood sugar, you'll feel dizzy, you'll feel out of sorts. Another thing that can happen if a person is overweight, it usually means that your adrenal glands, which are these little glands that sit on top of your kidneys, they get strained by all the demands that excess weight and how you get overweight puts on us. The adrenal glands have the effect of, when we move from one position to the other, they change the blood pressure in our arteries that go up to our head. And we might have even discussed that in our last episode. We might have talked about how when you move from a sitting or laying down position to a standing position, if your adrenal glands are insufficient and they're not putting out these hormones that control the blood pressure in the arteries in your neck, you could get dizzy, lightheaded, or even you might even faint. So those are some possibilities, Stephanie. When people say you should lose weight, it doesn't sound like they're talking sense, but they couldn't come up with any other things. And let's face it, if you are overweight, over time this is going to be a problem for you. So it won't cost anything to take their advice. Try losing some weight. Try sticking to that low carbohydrate diet. Get plenty of fats in your diet. Get a modest amount of protein, and see how you do. If you continue to be dizzy, you should probably go back for additional tests. But in the meantime, take that excess weight diagnosis, because it's a simple one. Try working with that for a month or two and see how you feel. Stephanie, thanks for the question. Okay, Rick writes in from Danvers. He says, 15 years ago I had to have knee surgery, and I had the old-fashioned way to replace my knee. I got a big zipper scar. But when I started doing physical therapy for it, the thing that hurt me the most was not my knee, it was my back. Now I tend to get back pain a lot, and my knee doesn't bother me as much as my back does. Is this just in my head, and do you have any ideas why? Well, there's a couple different things that I can think of off the top of my head. If a person has a knee replacement surgery, the question is, when they replaced the knee, did they make sure that it was level? Was it even, Steven, with the opposite knee? So let's say if they replaced the right knee. Did they make sure that when you're standing, the right and the left knee joints are level like that? Because if the one side is down a little bit and a little bit shorter, you're going to tilt downhill in your spine, and that can put a torque, a twist, a pressure into your low back. So that's one very common possibility. The other is, when you do any type of extensive surgery like the old-fashioned surgery where you have to cut open the knee, scar tissue can have an effect on the surrounding muscles. And right on the side of our thigh, there's a big band. It's called the iliotibial band. You might have heard of it, or the ITB. Iliotibial band starts in the knee area. It goes all the way up to our pelvis, all the way to the top of our pelvis. There's a muscle up there called the tensor fascia lata, and that makes a connection between your knee and your pelvis, so it'll affect your low back. So it could be a shortening on one side. It could be just the scar tissue. Scar tissue doesn't go away on its own. It's not like if we cut our hand and we have a scar on our hand, in a month or two, that scarred area will heal up and go away. You won't see it anymore. But when you make a deep cut, a deep wound in a person, because that's essentially what surgery is, it's a deep wound, but it's a controlled wound, you're going to have scar tissue that's deep inside. It doesn't go away. Now on the surface, it may become over time less red, less noticeable, but deep inside, all those tissues are matted down. If the tissues are matted down, it won't allow the muscle, like that iliotibial band and the tensor fascia lata, to move, slide, and glide and function normally. If something doesn't function normally, after a while it ends up hurting. How can you help yourself? It's somewhat hard to help yourself. You can try using kinesio tape along the iliotibial band and see if that helps, because that would be a simple thing to do, won't cost much. You can also get some therapy in that area. We treat people with low back pain, knee pain, hip pain, by a variety of means. Some of it's manipulating joints that are stuck, some of it's muscle work to free up those scar tissue areas, and sometimes we might give exercises or use what we call kinesio tape in the area to return the function. Nice thing about these things is it works quickly. You don't have to wait months and months to see if there's any results. I look to see result immediately. In other words, person comes in, they have some back pain, say you do some work on the iliotibial band and have them redo the tests that they came in with just a minute ago and see if there's improvement. 9 out of 10 times there will be immediate improvement. So that clues us in that we've made a good choice of therapies, and you continue along that way until the person reaches their maximum function. If you have had knee replacement surgery and you're having back pain now, letting it go, not doing anything, or getting shots in the back is not the way to get better. Better way is to discover what's causing your pain, get it treated, and let yourself resume function with the least amount of interference, least amount of drugs, least amount of surgery possible. So thank you for that question. That was a good one. Okay, Leonora writes in from Danvers. She says, I broke my left arm in high school and it didn't set right. It never was able to bend all the way again, so I can't fully flex my left arm. And for viewers, this is what flexion is. Okay, that type of a bending like that. So ordinarily we can bend all the way up like this. Apparently she says she can't fully bend her arm. 30 years later, it still doesn't move like it should, and now I have pain every day. Oh, this is what Leonora says. It's not pain in my arm, it's pain in my neck. I try to stay fit and work out at least 4 days a week, but I get neck pain in the middle of the night and neck pain every time I do push-ups. I don't want to take the time off for another surgery now, so what can I do? Okay, Leonora, it's likely if you had a fracture and it didn't set right, you probably have more than one problem going on at a time. One is, what she says is she can't fully flex her arm, so this is full flexion here. Let's say she only has part-way movement. Could that be a problem inside the joint? It could be a problem inside the joint, but even if it's not, could it be some of the connective tissue back here or in here, in the muscles, that stop her from fully flexing? So she doesn't want to have surgery to go in there and do something to the joint to see if it'll make it any better. What I would suggest is have some soft tissue work done, have some hands-on manipulation done. Joints can sometimes be lightly manipulated to free them up, and sometimes just a little bit of excess or extra movement gained in a joint is enough to gain increased function. And when you gain increased function, if you improve your function, you almost always have less pain, because lack of function usually equals pain. When you have good or perfect function, you almost never have pain unless somebody punches you or damages you and traumatizes you. And her trauma, from what she had to say, was 30 years previously when she was in high school at age 17. So what's the answer? Good care, manipulative care, work on the muscle. It's usually not the type of thing that you can do for yourself, but you can try. If you can't fully flex your arm like that, probably the first candidate I would look for is look for a trigger point. Look for an area in your tricep. Try going back and forth across the grain if you're the type of person who wants to try to do it yourself. See if going back and forth across that grain of the tricep muscle, you can gain a little bit of movement. Because when you have pain or dysfunction in one area, it starts a chain reaction. So she probably has a problem with her shoulder, probably has trigger points on the backside of her shoulder and in her rotator cuff muscles, because they can all refer pain down to her hand. She mentioned she had pain in the left hand. So Leonora, that's something you can start on your own. It won't hurt you to try that. And after 30 years, it's certainly worth a try to get better, to regain your strength and function. And here's one thing. She notes that she has pain every day when she does her push-ups. Maybe don't do your push-ups. I mean, push-ups can be a wise idea, but if they're causing you pain, it says to me you shouldn't be doing them right now. Maybe not always staying away from push-ups, but right now, if you get pain in your neck every day from doing push-ups every day, those push-ups are doing you no good. Stay away from them for now and go back to them at a time when they don't give you pain. Okay, our next question is from Mike. Mike writes in from Middleton. He says, I get cramps in my feet at night, and my friends say I need calcium, but some of my friends say, no, I need magnesium. Is there a way to tell which one you need? In other words, do you need magnesium or do you need calcium to stop you having cramps? You might need both. I'd say as a general rule of thumb, almost nobody in the United States gets enough magnesium per day. For one thing, how many ads do you see for magnesium? You don't see them, but how many ads do you see on TV or in other places? Get your calcium. Now, calcium is usually thought of as something to help your bones stay strong. So women, as they get older and go into menopause, they become concerned about osteoporosis, losing calcium from their bones. So just about everybody has heard about different ways to get calcium into your body. Not that many people know about getting magnesium in your body. And both calcium and magnesium don't get that much scrutiny when it comes to muscle cramps. But yes, a lack of calcium can lead to muscle cramps. And yes, a lack of magnesium can lead to muscle cramps. Which one is it? I'd say it's likely to be magnesium, but to be safe, take both. But here's the deal. Don't take them both at the exact same time. You could take them on the same day, but take maybe the magnesium in the morning, take the calcium in the evening. Why? You want to get the most bang for your buck. And calcium and magnesium, unfortunately, they compete for binding sites. So imagine it was like a narrow door and two people are trying to get through the door at the same time. Well, that's a little bit like calcium and magnesium going through the door at the same time. They both can't get through the door at the same time, so if one goes in, it keeps the other out. So don't have that competition. Just take magnesium at one part of the day, take calcium at another part of the day. And here's the thing about magnesium. You're not going to get it that much in your foods. It's not in as many foods as calcium is. Calcium is in many, many foods. Magnesium, not so many. Off the top of my head, I can think of one food. Peas have a fair amount of magnesium, but you need about 600 milligrams of magnesium each day, and there's a little bit less than 200 milligrams in a cup of peas, so you'd have to eat over 3 cups of peas every day to get you the minimum amount of magnesium. How many people eat 3 cups of peas per day? I'm going to bet you not too many. How many people want to eat 3 cups of peas per day? I'm going to bet you even less. So taking a supplement, looking up the foods that have magnesium is not a bad idea. But taking a supplement is probably going to be pretty necessary. Which is the cause of your cramps? It could be either It could be both. Taking both is probably a smart idea. There can be other reasons why a person might have cramps in their feet. Particularly, a person could be flat-footed, not know it, and not wearing properly supportive shoes or orthotics. But that's a different question for a different day. So I've run out of questions for now, so I'm just going to say that this has been Natural Health Show today with your host, Dr. Stephen Blomerth, and we invite you to participate in the show to answer your health questions and concerns. We'll slightly disguise your name, and you can write in your question to peabodychiropractic@gmail.com. You can telephone my office at 978-535-6155. Or you can send an old-fashioned snail mail letter to my office address, which is 215 Newbury Street, Suite 102, Peabody, Massachusetts, 01960. Whichever way you choose to participate in the show, we'll be glad to talk about your question and natural health means to help you out. So thanks for watching. I'm your host, Dr. Steve Blomerth. See you next time. Bye-bye.